Hey, this is Brandon with ChiroUp. We talk about marketing and we talk about having a good website, being excellent clinically, doing everything from getting Google reviews to MD marketing. And those are all important because people are interviewing you on a regular basis, whether it's through your online handouts, whether it's through your website, or anything you put out of your office. However, at some point, patients are going to be walking into your door. So then what do you do to impress that patient? So here's my office. What we're going to do is we're going to take an online tour to see how we do things in our office to improve patient satisfaction.
So the frightening part is I have no idea what Dr. Steele said. So what we'll start out with is really there are 5 C's to patient satisfaction: comfort, convenience, compassion, communication, and cost. So let's look at 20 ways that Premier Rehab, our flagship clinic, makes an impact on those. The first way is that it happens well before the patient ever gets to see the provider, which is probably good news. But the patient makes the impression based upon the front desk, based upon what happens with that initial interaction. So we want to make sure when the patient comes into the office that they're greeted warmly, that there's nothing more important than that patient. That the staff needs to know that smiling to the patient, maintaining eye contact with that patient, and addressing their concerns is the most important thing that they can do.
And they don't want to be here more than they have to be. So one thing that we do is have that welcome email. So they can have a lot of their information filled out, so we don't need to bother them with sitting in a chair for long periods of time. They're ready to go, and we have an appointment time ready for them.
The other thing about the welcome email is it kind of reduces that buyer's remorse right off the bat, that a lot of times patients will schedule a visit and then half an hour later or the next day they're feeling a little bit better, so maybe they don't show up. That email, which is customized to your practice, is important to say, here's what we're about, here's what we're going to do for you to assure that patient they've made the right choice. And then once they get here, they need to be reassured that they've made the right choice. Let's face it, there's a lot of scary things in chiropractic offices. So one of the things that we'll do is a new patient welcome tour. When the patient comes into the office, after they've filled out their initial paperwork, which hopefully is minimal, we're going to take the patient on a tour through the office of here's what you can expect. This does a couple of things. Number one, it allays their fears as to what's in that room, but it also educates them to the things that you and I treat that they may not know about. They're here for lower back pain, but if they don't know that you also treat rotator cuffs, you may never see their sister with rotator cuff problems. So we'll take them on a tour, we'll explain what's going on in the office, we'll tell them how they can sign in initially, we'll teach them about what the rooms look like. We'll even take them into the seldom used now x-ray room. And so the x-ray room is one of those scary rooms, and it has to be up to date. It has to look like your technology is relatively new. It should have newer pictures, it should have newer color schemes, and it should be pleasing. One of the things that we can do to assure that we have pleasing offices is something called a 5 Census survey. That have you ever been in a room where the clock is ticking, but you forget the clock is ticking because it just becomes normal? Well, that room is called your office. You forget about all the things that you walk past and you look at on a daily basis that the patient doesn't walk past. That person picks up on each one of those things. So we'll want to go through our office, and it's a great drill to do at your next staff meeting, to sit down and say, what could we do better about this room? What's the smell of the room? What's the sounds of the room? Is the music pleasing? What's the comfort of the room? If somebody has lower back pain, do the chairs have arms? Are the chairs well upholstered? Are there cobwebs that say, we don't care about the office? Is the staff in neat uniforms? That everything about the office shows that you've paid attention to all 5 senses. The taste may be a tough one, but you can at least do 4 of those senses.
I think that's a good point, because if you look at a lot of the new modern offices, you have white everywhere, and white gets dirty. If you look at around your doors and you look at your baseboards, you're going to see a lot of stuff that if you really take a close look, that's what your patients are looking at. And I think that's important because patients are on this welcome tour, they're going to get a good sense of what to expect with seeing you. And unfortunately, if things are left undone, then that's where you can run into a problem. Now, one thing that I think that is very important when designing your office is the space, because patients are going to be coming into a space and want to know where they're going to be and expect that. With our scheduling system, I really think that looking at a point system like we use is very beneficial. It allows you to see and maximize your office visits for that patient. So the way we use our point system is we see a certain amount of patients per hour. So if I have a new patient versus a re-exam versus a patient who is maybe takes a little bit more time, I can assign them a certain amount of points so I can make sure that I'm busy doing what I do and patients aren't waiting around for undue reasons.
It really puts more of a science than an art into scheduling, because one of the big C's is convenience. That if the patient is running behind, or you're running behind, and now you put that patient behind and every other patient the rest of the day behind, that's not a satisfied patient. That's not an excited patient who's going to tell somebody about your office. Let's face it, that satisfied patients will show up, but excited patients refer. And one of the best ways we can keep that patient excited is to make sure that we make best use of their time every visit. And we love the point system because different providers can have different points. That maybe Dr. Steele sees X points per hour and I see Y points per hour. With the point system, we can make sure that we're both on schedule for that patient.
It helps everybody. It helps us and the staff understand what patients can fit, where. I think another thing is the cost. Coming in to see a chiropractor, that's often difficult with different insurances and different plans that you may have. We know that we have a front desk staff that tries to accomplish that on the first day, meaning knowing what they're going to pay, when they're going to pay, what their deductible are before they leave for that first visit. It's unfortunate, but a lot of times patients, that's their biggest fear in coming in to see us, is they don't know how much it's going to cost per visit. Now we can of course let them know insurance-wise, but also being sound clinically and letting them know per condition what we expect their prognosis will also help.
That really our value comes in our results divided by the price of a visit and the number of times that patient is going to be seen, and really the number of times is probably the biggest modifier. So going on with the 5 C's, we're also going to look at communication. That's a huge one, that we're going to communicate at the front desk what that financial policy is, but we're also going to communicate everything else we want that patient to know about our relationship. So we'll use tools like a monitor, where the monitor it's a rolling slideshow. You can use an iMovie, you can use a PowerPoint presentation, burn it onto a memory stick and stick it into the smart TV, and it'll just scroll. We have some things that are humorous, we have some things that are inspirational, but we have a lot of information about the things patients can do to help their own condition and the other conditions that we may be able to help them with.
And if you can turn around and see the rack cars, another thing that is really interesting is as many decades as Dr. Burles has been in practice, people still don't understand everything that he treats or that we treat in our office. And a lot of times just having simple rack cards, these are on ChiroUp. You can customize these to your clinic just as we have. And if you don't like the colors, we can also customize that. But there's a lot of people who don't know that we treat plantar fasciitis or headaches or any other conditions. So having rack cards available will allow you to expand the amount of conditions and your reach within your community. So that's one thing that I would definitely consider. One other thing, as far as communication, we are pretty clinical. However, we also have a personality. So we have these boards, and these boards always incite a little bit of conversation within the treatment room. So we'll have a board here, and then also usually a saying. I haven't even read it yet, so I don't know. Yeah, that's a pretty good one. So I think that those things will give you a little bit of personality in your practice, and then also provide a little bit of conversation within your office.
Because that communication needs to be more than just the clinical aspect. It needs to be a relationship with that patient. So we want to make sure that we're recognizing special events in their life. Has that patient had a graduation? Is there a birthday coming up? For birthdays, we have a form. You can drag that out of ChiroUp as well. We have 5 different birthday scripts that we rotate through the years. We have birthday themed paper, have the staff sign the bottom of the paper, and it can be sent out, emailed out, or if need be, mailed out automatically. But things like special events and even events like a sympathy card or a get well card. If it's something that we're going to have a positive experience, we'll have a Premier Rehab card that we'll fill out, a little note card that we've custom made. If it's something that's not as positive an experience, then we'll buy a sympathy card or a get well card. I think the biggest form of communication is what we do during the defining moments. So the defining moments for our patient are times that, number one, they've finished their initial consult. And at the end of the initial consult, we want to make sure that patient understands that we understood. So a powerful tool that we routinely hear about is repeating back to the patient what they told us. Mary, you told me your back pain starts here, here's what makes it better, what makes it worse, did I miss anything? And that 30-second repeat of that script makes a powerful impact. The other thing that we want to tell them is that if we need to delay treatment for any reason, because we need an x-ray, we need an MRI, or to order a test, we need to let them know why that's happening, that there's a reason that's happening. And probably one of the most important communications is at the end of the initial visit, to set an expectation that that patient came here to feel better. But let's face it, they don't always feel better the first visit. So we need to set the expectation that, Tom, that's what we're going to start with today. You may feel some soreness from what we've done. It often takes a couple of treatments to make that happen. But after a couple of treatments, we'll see things moving quicker. So set the expectation that you're probably going to get sore, and if they don't, they're even more excited about an expectation that was exceeded rather than one that you failed that they had in their own mind.
And setting those expectations is the number one thing, so ask questions. After that first treatment, say, do you have any other questions? Because we're going to give them all the information that we think they need. We're going to do that through our condition reports. When they leave our office, they're going to have their diagnosis, what we're going to do about it, their exercises, how they can modify their ADLs. They're going to have all that information. And one of the other things that Dr. Bertelsmann taught me, this is just what, 2 or 3 years ago when I started practice, is calling the patient, because sometimes there is a little bit of hesitancy with asking questions. You're throwing a lot of new information at them. So calling that person after their shift, after your day, when it's convenient for that person. I get in the car and I go through my list, and I'll give those people a call and answer any lingering questions they may have. And also that's a big boost to the personal communication. They now have your number. I say, listen, Sally, if you ever have any questions, I know it's the weekend coming up, I want to make sure I'm here for you. Here's my personal cell phone number. And it instills a little bit of trust in that patient to know that you guys are going towards the same goal.
So those are powerful moments. And in addition to the ChiroUp condition report, which is communication, so certainly every patient, and we print these out for our patients, not just email, a powerful communication that let them know what's wrong, what we're going to do, what they can do to help themselves, including their exercises. That's the foundation for outcomes. It's the foundation for good patient communication. But we've created one more tool that I think you're going to love. It's called Boost. Boost is a new dashboard function that if you go to any of your dashboard metrics, the 9 indicators, the key performance indicators, you'll be able to hit the Boost tab to come up with a checklist of actions that you can do. The 20 things that we talked about today are in there, plus about 20 to 30 more. You'll have all the scripts, all of the marketing campaigns that go with it, all of the assets, all of the tools and tutorial videos that you need to boost that asset, and we are very hopeful that you'll be able to use those to make those metrics go higher and higher. We're thankful that you watched this video. Hope you learned something. If there's anything that you have questions about, by all means respond to the post, the blog, or whatever means you digested this information. And once again, thanks for letting us be part of your practice.
Thanks.